just to check the vision. We always check the vision ourselves anyhow. So we'll get started then.
Okay. She had a suitcase on wheels.
Oh gosh, you're right. Yeah, that's right. Crystal.
She did. I don't know her name, but she did a battery test on her. She's had a burn and then motions and stuff.
That's right. I was seeing a bunch of patients in the clinic across the street that I forgot she told me that she already put in the drops and tested the vision. So you don't have to go through that twice.
Oh, good. Good deal.
Yeah, sorry I forgot about that. I'll get later. And it sounds like everything was quite reassuring though earlier from what she saw. Yeah, definitely know Crystal was on, or Dr. Lee was on before me because I'll have to readjust this headset quite a bit. Alright. Now with the drops in place, we'll just take a look at the back of the eye. So who's your doctor who sent you here?
Dr. Simonton, Jason Simonton from St. Margaret's Hospital.
Oh, okay. He's an ophthalmologist?
Yes.
Yeah. I should have for an exam. I didn't expect all this.
She just had her cataracts done,
Okay.
and this was a follow-up.
By Dr. Simonton?
Yes, and that's what he...
6 months after.
Got it. Do you have any high blood pressure, diabetes?
No.
Do you smoke, or did you smoke in the past?
And I've had years ago.
Years ago.
Yeah.
I heard you have some issues with the vessels from your heart.
I did, yes. But I had open heart surgery.
I see. Okay. Besides the cataract surgery, any other issues with the eyes?
No.
So no glaucoma, macular degeneration.
Well, he was actually in the macular degeneration due to preservation.
Oh, so you're taking that.
She's been taking that faithfully.
Okay, but no injections in the eyes.
No.
Okay. All right, let's put that up a little bit here so we can get a better look. And look all the way up. This is the right eye.
I thought it was okay.
Sharp chin. All the way up. Up and to the left.
Okay.
Actually, so I'm going to bring you up a little bit more. Protect my back. I'll bring you down in a moment. I'm moving your head back a bit for now. You okay there?
Mm-hmm.
Alright, sorry. Up and to the left again. Up and to the left. A little bit more up if you can. All the way to the left. Okay. Down and left.
Done.
Down and to the left. All the way down. down towards your feet. Gotta keep both eyes open. Down and to the right. Towards where I'm pressing here. All the way to the right. All the way to the right. Let's go all the way to the right. Up and to the right. Okay?
Yeah, it's,
The lights?
it's okay.
Sorry, that's unfortunately the only way to see.
Yeah.
And up and to the right.
You're right.
Now, if you look right through my ear, this is the brightest one, okay, but the most important one. You get a break there.
Yeah.
And have you noticed any change in your vision?
No, I see it regularly, right? But,
Okay.
I haven't noticed, I haven't noticed dimming or anything,
And close your eyes once. I'm going to press a little bit here, okay? Does that hurt?
I feel like it doesn't
It
hurt.
doesn't hurt. Very good. Look all the way up. Up and left. Just go left and left. All the way left. Great. Down and left. All the way down. Down and to the right. A little bit more towards me. All the way to the right. Up and to the right. A little bit more right. Okay. Right at me, brightest one, okay? Nicely done there. So I do see the area that Dr. Simonson mentioned. It doesn't look like it's anything that just happened, actually. It looks like something that's happened at some point in the past, more likely in the past few weeks to months. If it's something that had just happened, I would be seeing some swelling in the eye, some swelling in the retina. I don't see any swelling. The fact that you haven't noticed any change in your vision either is also making me think this is something that's not new. Okay. Let me take a look at the imaging that we already have. I'll talk to the stroke doctors. We might not even have to get the MRI, to be honest. Yeah. Have you had any kind of weakness or numbness otherwise? Any issues with speech or swallowing? Any tingling in your extremities? Okay. Have you had any headaches?
No.
Strange question, but any pain in your jaw when you're chewing?
No.
Tenderness to your scalp?
No.
Neck or shoulder pain or stiffness? Nothing. Okay, very good. The fact that there's a little blockage there, it had to come from somewhere, right?
Uh-huh.
So it typically comes from an area in the artery in the neck, and a piece of it kind of flecks off and goes further upstream. Sometimes arrhythmias in the heart, things like AFib can cause it, um, or you can have other, clots in the heart that can send things off. Those are the most common reasons. Um, the fact that you have a clot there at all, then I'll leave it to the stroke team, but they might want to get the MRI anyway. It's kind of their decision. I just make some recommendations. But I'll let them know I don't think it's do you have high blood pressure? So I've already asked you.
No.
No.
No. I had low blood pressure, in fact, years ago, but now pretty normal.
Okay. All right. Well, I'm going to turn on the lights and we'll just check, see if you can count the fingers one more time. I think Dr. Lee found an abnormality there, so we'll just confirm.
Doctor, what's the prognosis of her getting another stroke, whether behind the eye or throughout the eye?
That's a good question. So we can treat this as a stroke in the eye, like you mentioned. It's going to depend on what the stroke doctors think is the underlying cause after we get some more testing. If there's an issue with the neck or if there's an issue with the heart, those kind of give different types of prognosis. The MRI is just to make sure that there hasn't been any kind of silent stroke, so to speak, that hasn't given you any symptoms, but may have taken place. Basically, the fact that you haven't had any change in your vision is fantastic because, that's not something that is an issue, and it's also drawing our attention now that everybody's seen out of the exam that there is some issue that could predispose you to having a stroke or something like that in the future. So basically, this is putting up alarm bells, and we can do some testing to prevent any further issues. While at the same time, you haven't had any change to your vision, thankfully. Good, perfect.
Well, you have to see his
Blindness
foot,
and
you see, but
paralysis?
I'm old too. I mean, I'm 88 years old.
Sure. It can if the clot had lodged not as far downstream, if it was in a larger blood vessel and that supplies the entire retina, oftentimes their vision is very poor from that. They can't see the chart on the wall. They can barely see fingers in front of them. So basically, the blood vessels, they kind of go out like this. And so if it was right here where they start, that would be the very bad situation. It's basically right around here. So it's gone further downstream, and it's not caused any issues.
It's good to know.
Any questions?
I don't know, ask you.
Well, I
It
guess.
seems like everything's okay.
Yeah, exactly. What's a good phone number to reach you?
440
Mhm.
292
Yep.
6288. That's
Now-
her oldest daughter, Mary Ann.
Now, do you have a follow-up appointment with Dr. Simonton, or does he want you to follow up with us to go back to him? Probably.
He said to follow up with a cardiologist.
Okay.
So that was her final visit from the cataracts.
Gotcha. All right. Well, you could follow up with him if you'd like in terms of the eye. There aren't many things that we have to worry about with this in the eye. So if you want to go back to him, or I'm also happy to help schedule an appointment to see somebody here.
Doctor, my age, I don't feel like I had any problem. I can see and I didn't know all this, but, everything seemed normal.
Yeah. So in terms of getting follow-up in the future, yeah, I mean, at this point, if we're just making sure, so you've already had the cataracts taken out, there's no concern for glaucoma, you're using the Preservision, things like that progress quite slowly, and you would know if there's a change. It's probably appropriate to space out the visits to every couple of years. So that would be up to Dr. Simonton, but I would raise that point with him.
Having the cataracts done, that in no way caused this.
No, not at all. All right. Let me. Yeah, I'll turn on the light here. We'll just check that real quick. So look at my nose. Without moving your eye, how many fingers do you see?
2. I think 2. 1.
Looking right here. I'm gonna open up this list and see if it goes to my nose.
1. Okay. 1. 2.
Looking right here.
I don't know. Maybe 1. I think 1. 1. I can't tell. 2. That's 2. I can see that. I think it's 1. 5. 10. 2. I think it's 2. I can't really tell.
Okay. Check one last time. So keep looking right here. Eyes wide open. Wide open.
2. 1, I think. 1. I think 1. 2. 1. 5.
Good. Okay. I think it's actually normal. All right. And forgive me. I saw the little obstruction there. It makes a difference if it's right where it branches off or if it's not where it branches off. I'm not going to torture you for another 5 minutes. Can I just take a quick 10-second peek?
Sure.
I just want to make sure I know where it is.
Sure.
To the right one more time. Up and to the right. Down and to the right. Okay, now right here, my ear, last one.
In the ear.
Gotcha. All right, thanks again.
Thank you.
So what I would do then, do you want to stick with Dr. Simonton to follow up? I would say just 1 month. If so, you can give him a call for the month appointment.
Okay. So I never struck in my eye or whatever.
Well, you did, but it's
Oh, yeah.
nothing that's new, and thankfully it's nothing that's affected the vision. Yeah.
So it's okay.
It's okay. It's good news overall.
Yes, it is. Yes, it is. Thank you.
Absolutely. All right, folks. Well, if you stay in the hospital overnight for any reason,
Yes, I am.
you will be. Okay.
Yeah.
Then, what time is it now? It's 8:30. Oh, it's yeah. Okay. Yeah. So the my boss, he's doing surgery tomorrow, but he'll come by and make the rounds in the hospital after surgery. If you leave before he's done, then that's okay. But if you're still here, he'll just come by and take a look. Take a look as well. Dr. Waxman. Yep. And he'll be back with Dr. Lee, who you met earlier. Okay.
Thank you very much.
Yeah. Take care, folks. Play it on or off?
Yeah. It should be on.
You put on.
Yeah. I said we've been doing this full time, Ron.